Hello, everybody, and welcome to the Practice Pulse podcast. It is a wonderful day today because I get to chat with Dr. Parul Dua Makkar, who is a friend, who's a dentist just like me, and who is a global citizen just like me. And it's wonderful to connect with her in virtually and bring her mission to all of you out there today. I'm going to talk a little bit first about who Dr. Parul Dua Makkar is. And Parul is a general dentist who practices general dentistry in Long Island, New York. And her life took a slightly different trajectory when she lost her only younger sibling, Dr. Manu Dua, who was also a dentist, to oral cancer. Following his death, Parul now devotes her time to educating doctors and patients about risk factors, prevention, and early detection and treatment of oral cancer. Speaking to audiences across the nation, she shares her experience and knowledge while guiding audiences in developing and understanding skills and preventive solutions for oral cancer. Dr. Makkar, you are changing the landscape. You're bringing oral cancer to front and center for us, both as providers and to family members. And that's a wonderful thing. So I thank you very much for bringing a voice for oral cancer.
Thank you so much, Aditi, for having me. And it's truly a joy. I don't think a lot of people understand us being global citizens where you belong to nowhere and everywhere, but you find your people. And I'm so glad I found you, and I'm happy to be here. Thank you.
Thank you. So let's start with your personal story, especially with your family experiences. It's so powerful. How has that influenced your work and your advocacy?
So, going back to being a global citizen, I grew up, I was born, I grew up, I went to dental school and college, and I practiced, and now I own a practice in all different cities, countries. And with that, I did not have the village to protect me from what I and my family went through. And my parents reside in Canada. My brother was in Canada, and we lost money during the time of COVID. So a lot of the grieving process was alone. And in that journey of navigating through watching somebody's sidelines of going through cancer, and then B, navigating the loss, led me to have people sit up and take notice of what really transpired here and how cancer can just affect anyone. And we need to be just watchful of it. So this is kind of how my journey into it all started, and to make a change, to make Manu more than just a statistic that he passed. Yeah.
Yeah, no, absolutely. It is so important that every life that we can impact, we try to make an impact in a way bigger than just you and me, right?
Absolutely.
And both as providers and in your case as a sibling as well. And I'm so honored really that you are taking that first step because as a global citizen, I know, and I truly know, without a village, how hard it is to take that first step. So I truly applaud you for doing that.
Thank you.
And and oral cancer is such a crucial topic. The awareness is so important. And why is it so important? And what are the early signs you think that people should look for?
So oral cancer has been rising for the last few decades. And the detection, there is no blood test. You can't go and get a blood work done and be like diabetes and, oh, you're at a higher risk or so forth, or urine test or a pap smear. You can't really detect it unless you show some signs and symptoms. And of course, we know the traditional risk factors, right? Smoking, vaping, and we know oral cancer has always been associated to this older man, in their 70s who's been a chain smoker and a heavy drinker. But that is changing. That patient population is changing. Of the 54,000 cases that are detected, a fifth of them are people under the age of 50 with no signs and symptoms, no risk factors. And a part two of this is due to the HPV virus, and which is the same that causes cervical cancer, and it's early detected by pap smears. So cancer is not getting detected because usually these lesions are painless, and they're, oral cavities, of course, one area. Like oral cancer is divided into two categories: the oral cavity, which is really the anterior part of your mouth, so up to your retromolar pad area, and anything beyond that, your tonsil, that's the oropharyngeal cancer. And the back cancer is harder to detect because unless it's grown and spread to different parts of the body, or it starts becoming painful, like hurting to swallow, hurts when you move your tongue, or you feel a lump, when a unilateral lump, so on one side of the body, that's when you detect more of the oropharyngeal cancers. But the oral cavity cancer is more like a white or red lesion that does not rub off. It's persistent. We always get some incident or in our mouths, right? You ate a chip, you drank hot coffee, you burned, you brushed the wrong way. Things happen. Anything should heal within 2 weeks. You get a syphilis, you get not syphilis, but like a
The
sore.
hand, foot, and mouth disease and things.
Right, head and foot
Yeah.
injury, or just an aphthous ulcer or a hepatic lesion,
Yeah.
everything should heal within 2 weeks. But if it doesn't and it's just persistent, that's when you go get it checked out, whether it hurts or not. And I think that's, we always associate pain, discomfort, then there's a disease process. And we know that in dentistry is not true, right? It's easier to solve a small cavity than when it grows bigger, and then you're ending up in a root canal or an extraction. Same thing with oral cancer. The smaller the lesion, the earlier the diagnosis, the more conservative the treatment. And this area is so vital. Cancer spreads through your lymphatic system and also through blood vessels. And this is such a highly vascular area. And we have all these lymph nodes in our neck area that the metastasis spreads, and it quickly spreads. So that's the whole key. It's knowing your body. It's doing those clinical exams when your patient's in the chair, asking the right questions, and just reducing your risk factors.
Yes, yes, absolutely. And would you recommend as dentists, and we're talking about not just us who are seasoned dentists, but also the younger dentists that are coming out from school, that, they take that extra couple of minutes in their exam to do a thorough head and neck exam and be suspicious of all the lesions and maybe ask the questions that need to be asked, whether it's uncomfortable or not for the
It,
patient,
right.
right?
Absolutely. And they do. We are taught head and neck exams, but, and I understand as a young practitioner, when you are starting out, you're maybe working on production, you have to get those big cases, and you forget in that race of like producing X amount of dollars that there's a person there. And even for any dentist, seasoned or unseasoned, when a person comes to you, they've picked you out somehow, right? Either you came recommended by a family friend, or they found you on Google and found a good review, or you take their insurance. Okay. And they're like, you're the closest doctor to me, and you took my insurance. Whatever the reason, the patient picked a time to come to you, and you've blocked off time for them for that half an hour, whatever time you are allotted. That's your only focus. Why the patient came to you. Is there something going on? Ask them the social questions. How much do you smoke? How much are you vaping, especially our teenagers? Like, it really doesn't take that long, and it can be a part of the conversation. Like, oh, you have dry mouth. Would you have medications? What else is going on? Are you sleeping properly? Do you snoring? Right? We go into sleep apnea, but we are asking all these questions. We are doing a comprehensive exam. Because if we want that seat at the table, and we are doctors, and
Mhm.
and we always get that, oh, you're just a dentist, you're
You're
not really
just a
a
dentist.
doctor. But we're
Yeah.
more than that, right? There is an oral systemic link. We know it's all linked together. And so if you don't advocate and you don't do that, then you're not being fair to your patient. And it's all about patient care. And patients will come to you when they realize you genuinely are taking care of them and not worried about the dollar sign.
Right.
And I think the young forget that. I know loans are high and all of that, but it will come if you're genuine and kind and keep your patient first in mind.
Right. That's absolutely well said. Well said there. It's so important to take that extra step, take the extra time to spend time with the patients. And now we have so many things out there to help, so many tools out there. Like we have the Veloscope. Um,
So
the,
many.
Mhm.
Yeah, so many. And especially for you guys. I mean, when I came out, we didn't have digital x-rays that were just starting to come out.
Yeah.
And, you know, the intraoral cameras were super expensive and all this technology, and you had to update. But now, and we didn't have smartphones. You remember the flip phones?
Yeah. Yeah.
Now we all have one of these. We all have
Yeah.
a phone. So even if you don't have a mouth camera, take a picture with your phone, you know, document the lesion and show the patient. You can blow it up on a screen and be like, look, this is what I see. This is why I'm concerned. This is your history. I'd like you to see you in 2 weeks. And if it doesn't go away, we'll do a biopsy. And any tool that you use, there are lots. There's Valscope, there is salivary tests that are coming out. You take a picture, and Valscope's not the only, there are other, you know,
Right.
fluorescent
Others.
advice, yeah,
Mhm.
devices. You can even do a brush biopsy, not in, you know,
Mhm.
and that's the other thing. Like if you suspect a lesion, and yes, you refer out, but if you're practicing and you're doing surgical extractions, you're doing implant placement, learn how to do a biopsy. It's not that big of a deal, especially in a tongue area that's, you know, maybe not in the soft palate, but hard palate you can do, not the floor of the mouth, unless you're a specialist. But there's certain areas, if you see something on the lateral border of the tongue, take a little snippet.
Mhm.
The tongue heals
Mhm.
beautifully and get the biopsy instead of having the patient wait and they'll forget or they'll not want to do it because they're scared of the word biopsy. Like those are the things to help the patient and never scare the patient like, oh, you're getting a biopsy, you have cancer. It's just like, I'm concerned. Let's get a lesion checked out. If it's nothing, then it's nothing, but I'd rather be safe than sorry.
Right.
And it's because I care about you.
Yeah.
But yeah, there's so many tools and we can compare and contrast. Look, the lesion's grown. Look, I've been watching this for 6 months, for a year. You said you've had it for a while. Like I have a patient, he has had a wart in his mouth for years. And finally he's like, okay, I want to get it out. I'm like, okay, let's do it.
Mhm.
But document it. We all know documentation is important and take pictures, store
Yeah.
them on. Yeah. So much
No,
easier than paper charts. Everything's digital. There's no excuse.
there really isn't. There really isn't. It's great. I mean, we definitely as dentists have our work cut out to that for us, to be able to document and treat these patients in the right way. But
Yeah.
what would be the most effective way to educate the public about oral health, I mean, oral cancer and its prevention, and also maybe hopefully reduce the fear when the dentist says, hey, you know what, I see something, we need to be able to look a little deeper you know
Yeah.
and I think that's when we have a lot of fear that it goes straight from 0 to 100 in the patient's mind. And is there a way we can educate them
Yeah.
beforehand, saying that, hey, not every lesion is going to be like that, but it is important to, dive deeper.
Sure. So most patients are aware. I mean, it says if they're smoking, it says it on the pack. People are aware. Um, One is when you're actually doing the exam, tell the patient you're doing the exam. It is rather intrusive. You're having them move their neck, you're palpating them, you're like, tell them what you're doing rather than they're feeling like you're
Doing
assaulting
it.
them. Like, what is going on here? Like, you're supposed to check inside. You're having them sticking their tongue out, you're checking the throat, you're checking the palate, you're doing all these things and you're palpating. So tell the patient, like, hey, I'm doing an exam. They may not even know that oral cancer exists, that you can die of it. I've heard all of that. And they may have had an oral cancer screening, but have not been aware of it. So that's the one thing, making sure they know what they're getting. And you're telling them what you're feeling or you're looking for. And then ask them, have you noticed anything? And if you see something in the mouth, look for the obvious factors. Like I had a patient, he had white stria on the floor of his mouth, and 17-year-old kid. And I'm looking at him, I'm like, do you vape? And he's like, no, nothing. Mom comes in, all. It's very, floor of the mouth is a very suspicious area. And then just asking questions, they're like, oh, we just got a new retainer. And I'm like, show me your retainer. And it's sticking, it's hurting the tongue. We adjust the retainer, bring the patient back, and it's gone. So not every lesion has to be cancer. It's asking, knowing what's going on. Is there a denture that's rubbing, ill-fitting? Is there a broken tooth? Is there a sharp thing? Have to change their new toothbrush? Oh, yeah, I went to medium because I didn't like small. Well, now you have all this on your teeth. So go back to your small, soft toothbrush. So it's finding things, telling them like, hey, if it doesn't go in 2 weeks or you start noticing any changes, come on back. I'll reevaluate you. Come in for 2 seconds. I'll take a picture, no worries. And then if everything looks good, we're not going to do anything. We'll just send you off. Have them rinse with salt water. Everything should heal. And so we shouldn't really like scare them, but just be like, okay, this is what's going on. This is what your history is. Oh, you have familial history. You've had lung cancer. You've had breast cancer. These are cancers that can metastasize because breast is right here. So, and the same thing with the lung. These areas can metastasize to the cervical area. So just be conscious of it. And same thing when you're doing pictures. You're going to do pictures. B, you're going to do your x-rays. Look at your x-rays. Look at
Look at the bone.
look at any radiolucencies that are there. And not every radiolucency is an endodontic treatment. Test vitality, test your teeth. And if you're doing the CBCT, even if you're not an oral radiologist, send your CBCTs out to be read by one, because the CBCT has so much information. Yes, you're doing it for your endo procedures or your sleep apnea patients, but send it out. There are things that it will pick up, from coronary arteries to pituitary gland. There's so much information. And you're liable for it if you're doing it in your office. So get those. So these are things to kind of like,
Also put out on the radar, right? For
right.
us, even as practitioners, not all practitioners know that there is a responsibility attached to, imaging. If you don't know how to read it yourself, make sure that you get either trained or get somebody else who is trained to read it, so that you are reducing your risk and also following your responsibility, right?
Absolutely. And I don't know how many people know this. We know the number one reason dentists get sued is perio. And the number two reason is failure to diagnose oral cancer.
Yes, I'm very aware of that. Yes, absolutely. Yes, that has been very interesting, because we had our head of the oral surgery department at the largest hospital here at Harborview. I had attended one of her lectures, and one of the first things she started with was, before she brought up the cases and things, was that you need to, first of all, you have to make sure that you look for these things and then you document them, because otherwise there's a very high chance if something goes undetected, you can definitely get sued. So it's definitely important that you do take the extra 2, 5, 7 minutes, whatever it is that takes you in your journey as a practitioner, to take that time to do this. And especially if you're using CT scans and things, you've got to make sure that you can read them, or get them read. So I totally agree with you there. A very, very important piece.
Yeah.
As a practitioner. And then, do you have any habits or routines that you could recommend for maybe decreasing the risk of oral cancer that you would suggest?
The main risk factors are smoking. And smoking with alcohol use, not alcohol use alone, but smoking, definitely vaping. And really watch out for the young ones. It's highly addictive, nicotine. In fact, nicotine or vapes that have nicotine are actually banned in Australia because they're so carcinogenic. There's a new product coming out, and I've heard, and I'm sure you've seen this on some posts. It's called Zyn. It's a kind of think of it as a smokeless tobacco. It's being used by kids and baseball teams because baseball has a high incidence of using chewless tobacco or chewing tobacco instead of smoking. And so their kids are putting this in their mouths and they're leaving it in their mouths for a long time. These are going to increase into cancer. So talk to your kids. Well, that's another thing. Be active in their lives. HPV vaccine is also a way to improve or decrease your risks. But it's a simple vaccine that you get 2 boosters, usually in the preteens before your child becomes sexually active. And anybody can get an HPV infection, and it usually clears our bodies within a year or two. However, for some people, it stays dormant and it becomes cancerous. And so just getting the vaccine prevents you from getting HPV-related oral cancers by 90%. And really, the important point is to get it before you become sexually active. Interestingly enough, the other incidence of, or the category of people who are more prone to these infections are people in retirement homes and later, because they're sexually active. So,
Right.
that it is the most sexually transmitted disease, more than STDs. So
Right.
getting that, if you chew, like we're South Asian community, so if you're chewing the betel quid, you want to try to avoid that. When you're outside, just like you protect your skin with sunscreen, you want to put lip balm to protect cancers of the lip. You can get basal cell carcinomas or you can get squamous cell carcinomas. So these are some like big factors. Of course, you want to have good nutritional diet. You want to have good oral health and a good immune system because all these factors, if your body can't fight an infection, then there are chances that it's going to lead to other issues. So having a good mouth, good nutrition, and visiting your dentist regularly.
Right.
Check.
Absolutely. That's right. No, that is one of the most important things,
Yep.
right? Go see your dentist. And as you said, right, then we are playing a role as into very comprehensive healthcare, right? It's all linked. And that's what people need to understand is that it's not just, oh, it's isolated, it's the mouth. It's not. It's part of the body and it's very connected. And it's very, very important that just as you go to the PCP, you have to go to see your dentist. So
Absolutely.
one thing I'm going to say, you have your book that came out, and I have a copy, it's a wonderful book, by the way, that was actually your brother's book, and you finished it for him and published it. And I think that's such an amazing gift to us as
Oh,
providers. So I really want to thank you for doing that and for um, taking his voice and giving it a voice and sending it out to all of us because that's wonderful. And hopefully that will help others to also understand that this is something that's crucial. And another thing that's coming on your horizon, you're becoming quite the public speaker, and you've been very vocal about it, which is really important because when there is an important mission, it is important to get uh, other people to understand that mission and to come and walk with you in that mission. And so when you have started, and I know this has been recent that you have started talking more publicly about awareness and trying to bring awareness to oral cancer. How has that journey been for you?
it definitely is not something I intended. It organically grew. I think with losing Manu and not having a village to protect me, I had to seek my people. I had to seek people who had gone through similar situations themselves. I found, talked to survivors, talked to survivors' families, whether dentists or non-dentists. Like I spoke to a woman who lost her twin to oral cancer. And she went to 3 dentists, was never diagnosed. And it was only when she was pregnant, she got diagnosed and died after delivery. And so there's all these cases I get to hear. Um, in fact, there's a dentist who survived cancer who lost his son to cancer. They were both battling cancer together. There's so many heartbreaking stories. And I'm in this profession. So was my brother. Ironically, Manu ended up with oral cancer, and I couldn't save him. And it was because of we were far away. Manu was getting care from an oral surgeon. And, and this is an important, if I haven't mentioned it, I'd like to mention it. Manu was given steroids thinking it was lichen planus. My point is that he never had a biopsy to know what it was. So never treat a patient unless you know what you're treating it for, whether it's a viral lesion, it's a fungal lesion, is it an autoimmune, is it cancer? So not to treat without knowing what it is that you're treating. And because he was giving steroids, the cancer kind of actually grew really faster because he got immunocompromised. That's my belief. But I couldn't save Manu. I tried my hardest, but I just thought there's got to be more to this story. Manu wrote words and he expressed himself that, he wanted this to be written. And that's why when I wrote the book, I finished it, I wrote the epilogue. And when I was writing, and I didn't even put my name on the cover because I'm like, this is your book. It's not, my name's on the inside.
Right,
But
right.
but I'm like, I couldn't take it away from him. I'm like, this is yours. And it was something that united us. We lived apart so much of our lives, but dentistry united us. We took courses together. And this book was our collaboration, something tangible that I can keep him with me. And then I just began doing podcasts and speaking locally, and it just grew. And I got to know people. And now this year I'm presenting for the American Dental Association. I got to present at my alma mater. I graduated from Oklahoma, so I was a keynote speaker there. And it just, yeah, it organically grew. And it's not a topic that has a big ROI. It's not like, oh, it's Invisalign, you're going to increase your practice by this much or implant. It really is no ROI in it. The biggest ROI I tell people is you're going to save somebody's life. You're
Mhm.
bringing awareness, maybe they themselves, but they may know a loved one that they're like, hey, my doc told me about this. You've been complaining about something. Why don't you go get it checked out? No, I hate the dentist. I don't care. Go get it checked out.
Right,
You never know whose lives you're going to touch.
right.
And so even if I save a life because of early detection, I'll be content that my mission was done.
Yeah, no, that's beautiful. That is beautiful. And we're here to support you. And, I know that you are going to be hosting your first oral cancer symposium coming up at the end of June. And, I want to spread awareness about that. So people, if you, Parul, want to talk about that and
Sure.
tell our audience what it is about, you've got an amazing set of speakers. You're not just talking about the disease process, but you're talking about the emotions that go. You have speakers that talk to the emotions
Mhm.
that play into when you have friends or family who are dealing with cancer and how you can help them. You have people who are dealing with after surgery, after cancer, and if they're in remission, how to treat them. You have lined up such wonderful, wonderful speakers. So tell us a little bit about the symposium coming up June 27th, if I'm not
Yeah.
mistaken.
So it's live on the 27th. That would have been Manu's 38th birthday. And but the recordings are available. So once you sign up, you can watch recordings. I know it's a Thursday and people are working, but you can watch the recordings till the end of the year. And so as I was going through this journey myself, there were so many questions I had. When Manu was like, oh, should I do radiation? Should I not? What kind of surgery? He had a feeding tube, he had a trach placed in, radiation burns. If you've gone through this process or you've watched from the sidelines, it's going through it is hard. And I can't speak as somebody who's had cancer, but it's hard. And watching helplessly, not being able to help your loved one there's a lot of other emotions with it. It could be guilt, it could be anger, frustration. And after the demise of the person, you can have PTSD. Um, there's a lot of trauma attached to it, even if you don't have it. So while I was going through this process, Manu had pain. What pain medications? What can he eat? He was prescribed a high sugar like boost, but we all know that high sugar increases cancer risk. So he was very particular about his diet and being on a keto diet. So there's all these facets. And I just didn't find my answer. So I created, and Dua is my maiden name, and of course my Manu's last name, and it's a pun of the word do a good job, just and bridging that gap between medical and dental professionals. So I start about what cancer is, how do you properly screen your patients, what are the oral systemic links, the multidisciplinary approach to it, and how do you treat wound care, burns from radiation, the emotional aspect. And there's going to be some hard decisions that have to be made. I remember when I was told we need to make Manu's end of life decisions. Imagine telling a 30-year-old, like, you need to decide put your affairs in order, you may not survive. And yes, life's not guaranteed, but when you're kind of given a death sentence, your mind frame is not quite there to focus. And it's hard to do it and you want to shove it but it needs to be taken care of. So how do you do a will? How do you do an estate planning if you have your own practice? Who's going to take care of it? Something happens to you. And the aftermath, and if you've survived cancer, there is life after cancer. Whether or not you can't practice your profession, you're alive and you can inspire and still lead a full life, There's an identity change, scars that are visible and non-visible. There's so much to cancer than just saying, oh, you have a lesion, go to my oral surgeon, here's a referral, end of story. These patients are coming back to you. They need fluoride trays, they need radiation trays, they need cleanings. They may be disfigured. They're going to have psychological impact. They may not want to come to see you because they can't open their mouth. They can't brush their teeth. They can't chew food. They can't swallow. There's so much more to it. And we're healthcare professionals. We should be aware and we should know how to help our patients.
Absolutely.
Or refer to the right place.
That's right.
You need to
And
know
that's
that
amazing. And it's so awesome that you have managed to, do get this virtual symposium organized and put people in there that are, how do you say, visionaries in their each little niche and who are speaking to a larger audience and wanting to get them engaged and also be a part of the story,
Yeah.
Don't just watch from the sidelines,
And these are amazing speakers. Most of them are my friends, and we've known my story, my mission, but there are people in there who I've never met in real life, but our ideas and our focus on cancer prevention is so uniting that they were like, yeah, let's do it. So I'm so grateful to them. It wouldn't be possible without all of them.
Yeah, no, that's awesome. And if you want to share of when you are holding it and if people want to join, what is there a link that they want to register for this? I know you're providing CE as well, right?
Yes. For dentists, all dental professionals. So whether you're a student, a resident, a hygienist, an assistant, it's great for you guys to, and hygienists need to know they're in there and they usually see the patient longer than the dentist, and they can point out, hey, my hygienist always does. I saw something here, or I saw a cavity, or
Yep,
they need
absolutely.
so like they're diagnosing or looking at all of that, they can do a valve scope check. And of course, dentists and specialists to get everyone to look, and CEs are provided for them, but it is for all healthcare professionals. Even if you're not a dentist, you can absolutely join in because there's so much, there's a disconnect sometimes with medicine and dentistry. A lot of doctors don't know that, oral cancer exists or what to do or where they need to go. So they're not aware. And so it's kind of linking and putting all the puzzle pieces together.
No,
And yes,
absolutely.
yeah,
Agreed. Well, like even for instance, my functional therapist, it's wonderful. It's the things that they can do these days, especially like I know of one who treats patients, oral cancer patients, especially after surgery, to
yeah,
get more mobility in their in their tongue, in their jaw muscles, to get things moving
mhm,
because that's one of the main things that's affected after surgery and or
absolutely.
after radiation. So, but a lot of our medicine colleagues, unfortunately, don't even know about that.
They don't. Yeah, they're
They,
going to speech therapy. They
yeah,
have to learn how to swallow.
yeah.
They have loss of taste,
Mhm,
and they need help.
mhm.
Um, so yes, so you can definitely register. It's duagoodjob.com. Um, and I have survivors there talking about their aspects and stories. And it's just, there is hope. That's not a life sentence. And I hope it leaves you educated, be a better practitioner, be inspired by it. And yeah, join in. And there's a little swag. And of course, you get the copy of the book with
No,
it.
it's a great book, and you're such an inspiration. I want to ask you, kind of leave you with one last question is how do you see the field of oral health care sort of evolving over this next decade?
As we're getting to know that oral health is linked to diabetes, it's linked to heart disease, it's linked to poor perio is linked to stroke, Alzheimer's. I mean,
You name it.
you name it. Oral care is important during pregnancy. A lot of patients won't go to the dentist. I'm not going to the dentist. I'm pregnant. I don't want x-rays. Yeah, we're not taking x-rays, but we're going to do a cleaning because hormonal changes will cause, pregnancy gingivitis. Patients don't know that. And so it's hopefully that over the course of time, it's bridging this gap and that people don't think, oh, you're just a dentist. I don't need to see you, but I'm going to go to my follow up and do all my
Mhm.
head and neck. And I hope that patients, with more salivary testing, that we can detect other stuff
Yes, that's
earlier
very
on.
interesting.
It's coming up.
Yeah.
And, you know, that insurance not be a barrier to getting healthcare. Like you do your salivary testing, it may be a couple of $100 out of your pocket, but you know what? It's related to whatever the your oral microbacteria is. It is related to the rest of your body, to your gut, to your heart
Absolutely.
condition, to your diabetes, like everything, to your cholesterol, hypertension. So,
Right. No, since you brought that up, I'll tell you, I did oral salivary testing through a company called Biome, and I
mhm,
did it on myself, right? And I said, hey, I want to try it, right? And the insurance and things does not cover it. But it was very, very interesting because it told me about my entire oral microbiome makeup. And then it was very interesting because it gave me a score on risk. It gave me a risk report, like what is the chances? I don't have oral cancer right now. What are my chances of getting them in the future based on what my oral microbial makeup is? Or, it told me about my caries risk. It told me about my risk for periodontal disease and, what I could then do once I know where I fall, I can maybe do things to
right.
make things better. So salary testing is coming, it's coming in a big way. And there's some really cool things coming out. And like you said, insurance shouldn't be a barrier to knowledge,
Yeah,
right?
sure.
Because only if you know what is wrong with you or what you are doing wrong, you can course correct. If you have no idea, if you're shooting in the dark, then then don't be surprised by disease process is all I'm going to say,
Right.
right?
Right. Like there are patients who are like, oh, my husband's never gone to the dentist, never has a cavity. I come every 6 months and you find a cavity. Well, there is genetics involved, but there's also what your oral flora is like. No, it's absolutely true. It's bridging that gap and hopefully that it's a more comprehensive care and it's together.
Absolutely.
And
Well,
prevention is the best. Prevention
prevention
is,
is
yeah,
definitely the best.
yeah,
And together, I hope that, we are able to spread this message of um, both awareness and also the fact that people need to not only look in the mouth, but they need to look at their communities as well and see their best practices, in terms of hygiene. So many things are affecting hygiene. I know there's a major hygiene shortage going on across the country. And, this is a little, what do you call it? A little hope, a little pray to incentivize the hygienists and say, hey, we need you.
yeah,
Uh,
desperately.
desperately to
Yeah,
be able to treat our population the way we really want them to be treated. So, just all the hygienists out there, we love you because you give us a second set of eyes.
yeah,
And you are our right hand. So I hope you guys all keep loving hygiene
yeah,
because we can't do the best job without y'all,
yeah.
really. Yeah.
Yeah, and it's a team. It's not like, oh, you're here in the hierarchy. There is no hierarchy. It's a team and patient care is your focus.
Absolutely. Well, thank you so much, Parul. This was so wonderful. It was great to connect with you,
Like,
both in the oral cancer realm as dentists, but also as global citizens, because we truly get each other. And it's rare to find those people who understand.
yeah.
So, and thank you so much for coming onto this podcast today, taking time out of your busy day and chatting with me about your journey in oral cancer. Thank you.
Thank you. I'm so honored that you had me in this new podcast that you're sharing with the world. Good luck with all the adventures.
Thanks.